Well, first, let me introduce myself. I'm Dr. Andrew Cutler. I'm a clinical associate professor of psychiatry at SUNY Upstate Medical University, and I'm the chief medical officer of the Neuroscience Education Institute. I've been doing clinical trials for 30 years on new psychiatry medications, including atypical antipsychotics and LAIs. And I'm very proud to have been an author on this poster that we presented at the 2025 SIRS meeting, which is the Congress of the Schizophrenia International Research Society, was held at the end of March, beginning of April of 2025. And this poster is regarding a treatment, as you mentioned, that is called, it has a funny name, TEV 44749, which is a subcutaneous long-acting injectable form of olanzapine, which is a very effective antipsychotic. And what's exciting here is that this is a subcutaneous injection of a long-acting antipsychotic. Most of the others are intramuscular, so you have a bigger needle, they go deeper into the muscle, whereas this is a small needle, goes subcutaneously. So the method of administration is definitely a step forward, but also it's olanzapine, a very effective antipsychotic. Our current LAI medications really are two basic molecules. They're either risperidone or paliperidone, which is essentially the same because paliperidone is the active metabolite of risperidone, or they're aripiprazole. So another really important aspect of this medication is that it's a third different molecule because not every patient responds well or tolerates all medicines. So it's nice to have another option that some people may do especially well with. Now, this particular study that we're presenting is an attitudes survey. This survey included 70 patients who actually participated in this study and 35 healthcare providers that included 11 physicians and 24 nurses. And what we did was we asked them about their attitudes about LAIs in general, the method of delivery, the initiation regimen, and about their experience in this study and with the subcutaneous olanzapine in particular, the TEV 44749. At this point, it just has that number. It doesn't have a brand name yet or anything like that. So there were some very interesting findings in this study that are not necessarily surprising. So it turns out there is an LAI version of olanzapine on the market. It's an intramuscular version, and it is olanzapine pamoate. It has been significantly limited because of a risk called PDSS, which is Post-Injection Delirium and Sedation Syndrome. And this requires something called a REMS, Risk Emergency Mitigation Strategy. And this is a special program that patients have to register in, the clinic has to be registered, and it requires the patient to be monitored at the clinic for at least 3 hours after the injection to make sure that they don't have this side effect. And that's really limited the use because it's very difficult for a patient to stay, it's inconvenient. There's a lot of logistical issues for the clinic, and so it just hasn't been used as much. And so another advantage of this subcutaneous preparation is we don't expect to see this PDSS. And so far, there have been over 3,000, almost 4,000 injections given with this particular formulation with no evidence of the PDSS. And that would be a very big deal because then it wouldn't require this several hours of post-injection monitoring, which can be very inconvenient. So again, being able to offer the efficacy of olanzapine in a more convenient formulation of subcutaneous and without that serious risk that requires a whole lot of extra monitoring. Well, I think that if you're talking about the various options for LAIs, there's a couple of issues. One I mentioned is most of them are delivered by a deep intramuscular injection with a pretty big needle. And that's a little bit scary for some people. Sometimes clinicians feel like the patient won't want that, and so they don't even offer it to them. But the fact is we know that LAIs are extremely effective. We know that if you don't take medicine with schizophrenia, you're very vulnerable to relapse. It's hard to take pills every day for any medical condition, and we know that LAIs have been demonstrated to be better than oral medicines at keeping people free from relapse and keeping them out of the hospital. So LAIs are very effective technology, if you will. Now, as far as why we had such high patient satisfaction here is, number one, it's subcutaneous, so it's a smaller needle, and most of us have had a subcutaneous injection. Maybe we've had a vaccination, a flu shot, or something like that. Also, insulin is delivered by subcutaneous injection, so it's a little less scary, and that's what a lot of the patients said, that they preferred the subcutaneous. It was less scary. They liked the fact that with some LAIs, there's what's called an initiation regimen, meaning you don't just give one shot and that's it. It takes a while for some of the LAIs for the blood level to build up and become therapeutic, and that can take a period of weeks. And so with some of these medicines, you give a shot, and then the patient has to take oral medication every day for 2 or 3 weeks. And that can be a problem because not everybody is adherent or taking the medicine the way they should, and that leaves them vulnerable to relapse before the medicine gets therapeutic. Some of the medicines, you have to get 2 different shots. You get 1 shot and then maybe a week later come back in for a shot, and that's inconvenient. So with this formulation, you give 1 shot and that's it. You're covered for a whole month, and the injections are given once a month, which is convenient. So these are some of the reasons the patients really liked this regimen, especially those who had had an LAI before and realized some of the limitations of these other LAIs. Yeah, so this SOLARIS study, and actually I just got back from the European Psychiatric Association meeting in Madrid, Spain last week, where my good friend Dr. Christophe Carrel presented the results of the SOLARIS study. And this, again, is a pivotal trial, meaning this is a study being done to get TEV 749 FDA approved on the market. And the design of the study, as you mentioned, there was an 8-week double-blind period. These were patients with schizophrenia who had an acute relapse. They were acutely psychotic and they were in the hospital. And they were given either the medication at 3 different doses or placebo. And they were in the hospital and monitored with a rating scale we call the PANS, the Positive and Negative Syndrome Scale. That's a gold standard rating scale for psychotic symptoms. It's 30 items. And what we found was after 8 weeks, all 3 doses of TEV 44749 were significantly superior to the placebo at improving psychotic symptoms measured by the PANS. So very clear efficacy on working acutely for the symptoms of psychosis, of schizophrenia. And this was the kind of study that you do to get a drug approved, where you show that the drug is very effective acutely in those first 8 weeks. And what we saw was that even in the first injection cycle, the first 4 weeks, you saw evidence that patients were responding to the medicine as soon as the first week after the injection. There were also secondary endpoints looked at, and one of those was called the CGI, the Clinical Global Impression. Whereas the PANS measures 30 specific symptoms of psychosis or schizophrenia, the CGI looks globally. It's the clinician's overall impression of how the patient is doing, including everything, symptoms, but also function. And what we saw here again was that the medication was significantly better than placebo at improving the overall clinical impression, including symptoms and function. And again, all 3 doses were significantly better than placebo.